You're watching Mainebiz Sunday, Maine's business news source.
Funding for mental health services has been on the decline in Maine, forcing organizations to cut programs and staff and look for other ways to save money. What have these nonprofits done to stay viable in this funding environment? And how have the cuts impacted mental health care in the state? Will a new model for doing business as a nonprofit health provider emerge from this economic turmoil? Today to discuss this topic with us is Dennis King, CEO of Maine Mental Health Partners, and Dawn Stiles, President of Spurwink Services in Portland. Welcome. Glad you could be here today. Thank you for coming. Yeah, this is definitely tough times. We of course are reading the newspapers and understanding the constraints and the challenges that state budget and the federal budgets are going through, and we know that that really impacts especially healthcare and mental health care providers in our state. So we want to hear about some of the interesting and unique things that you're doing to kind of deal with that. But first, tell us who you are. Give us a snapshot of your organizations and tell us how they work. So let's start with you, Dawn.
Spurwink is a large social service agency. We provide services to about 4,500 children, adults, and families throughout the year. We have over 900 employees. We have a budget of about $50 million, and we provide services in 11 of Maine's 16 counties. Our services focus on educational, residential for children and adults, and outpatient and community-based services.
Great, great. Big, and pretty much statewide. That's great. Interesting, yeah.
Maine Mental Health Partners is part of the Maine Health System, and we have organized ourselves to include a number of entities that deliver a wide range, a continuum of mental health services, actually. We have, as members of our organization, Spring Harbor Hospital, a 100-bed psychiatric facility in Westbrook. We also have affiliations and memberships with community counseling, as well as with Midcoast Mental Health Center in Rockland, who are our newest member. And we also have a number of contracts where we actually manage services in other community hospitals, like Southern Maine Medical Center, and bigger hospitals like Maine Medical Center. And we have a full range of outpatient programs and programs designed to bring services into the home when possible.
Okay, good. One of the reasons we wanted to have you here today in particular was you're having to deal with these cuts from a kind of a business point of view and managing your budgets. What kind of new approaches are you using and kind of entrepreneurial strategies are you having to use that maybe we haven't used before in this kind of nonprofit setting?
What Spurwink has done is to identify new markets and new sources of funding. For example, our private pay adult residential program, Spruce Point, we rolled out this spring. We looked at what we do best and decided that there are people who can actually pay for our services other than the Maine taxpayers. So we sell our services to people who can pay privately. We also sell them to children from Canada, from all over New England, come into Maine. And last year we brought in $2.5 million in funds from out of state that were non-taxpayer sources of revenue and created 50 new jobs in Maine with non-Maine taxpayer money.
Great, good.
We're also doing things, we've developed some iPod applications for kids with autism. So they look just like every other teenager with some earphones in their heads and their iPod around their neck that we're selling on the internet.
Great, great. Okay. Dennis, how about you?
Terrific. Well, we've taken a slightly different approach, recognizing that we have the Maine Health region to support in terms of mental health services. And so one of the approaches we took is to look at what, in terms of the continuum of care that we have in our region, what are the specific areas that we're lacking to allow people to flow through the mental health system more efficiently and faster than they can now. And taking that approach, we then looked for partners, people who could help us fill the empty spaces, so to speak, in the continuum, and to work with them to share back office costs. So we found that by having them participate with us both at the governance level and at the membership level, we can come together to save, create a scale that we can save on things like insurances and things like group purchasing as well as just general working more closely together for the benefit of the patients.
Yeah. I'm so happy to have you here to talk about that, because clearly I think people think of nonprofits and this kind of level of service and think, well, they ask for more, but they're not really looking for ways to be more efficient. In your case, it sounds like you're really kind of squeezing every nickel out, looking for those efficiencies and ways to merge and share costs and services.
That's right.
You're looking for an entrepreneurial approach in terms of new product lines. What are the opportunities in this market that you can take advantage of and have a competitive advantage? I mean, that's real business, and that's I'm happy to hear that. So let me ask that question about kind of that mix of funding that you have. Between the private and the public funded, and the private side would be individual private payer and private insurance versus Medicaid and Medicare, I guess. So how does that, what's the mix, do you think? And is that changing?
It's definitely changing.
Yeah.
For us, probably 3 years ago, it was about 95% taxpayer money, and now it's down to around 80%, but that's still too high. And we're working every day to reduce that, but it takes time. As any business person knows, you can start a business, but it isn't profitable immediately.
Right, right.
Yeah, I'd agree. In all the sites we have, we found a tremendous dependence on the public funds, the Medicare and the Medicaid, probably to the level of 60 to 70%. We still get a number of private patients as well. That's an important piece for us.
And a market that sounds like you're wanting to expand in.
Yes.
You clearly are.
Yes, indeed. And you know, we see it as part of our mission to support business, because truly mental illness impacts business. We've both found impacts business very directly.
Well, that's where I wanted to take the conversation with that, because we're going to wrap this segment pretty quickly, but I wanted to ask you to weigh in on that, because clearly there's huge cuts. I mean, even though you're making that change, publicly funded is certainly the predominant piece. Why is that a good public investment? Why, as a business person, should I care and want to have my tax dollars invested in that? Why is good mental health services for the state good for business, good for my community, my workforce? Well, sell me.
Go ahead.
Every business person knows that if you have high absentee rates, that you can't be productive. And so there's a high percentage of a workforce of the population that's impacted by substance abuse, by domestic violence, by mental health issues, depression. Almost every chronic disease is impacted by depression. And if their kids are impacted, they can't focus because the kids are distracting the parents from doing their job at work.
Lost time, productivity.
In fact, it's called, we use the term presenteeism to describe people who are at work but not engaged because of the lack of focus.
Okay. We're going to wrap the segment here. We're going to keep you around for our afterthought segment so we can talk more about this, and it's going to be on the web. I definitely want to talk more about some of those cuts and how that's going to impact kind of mental health services throughout the state, and then we'll cover other things too.
Great.
Thank you for being here.
Thank you.
You can catch more of this discussion in our exclusive Afterthought segment, seen only on the web. Go to mainebiz.biz and click on the Mainebiz Sunday link. Stay with us. We'll be right back to speak with Michael Levert, Maine State Economist, and Chuck Lawton, Chief Economist at the Planning Decisions, about their 6-part economic series being published in Mainebiz. Stay tuned.
Mainebiz Sunday is brought to you by Bangor Savings Bank, where you can enjoy free ATMs worldwide.